Yeah, this is Doug Field, CEO of the Institute of Healthcare Consumerism, along with my co-host Ron Buckman. Welcome back to this segment of Healthcare Consumerism Radio, and we're going to continue our discussion on transparency. A lot of innovation taking place in transparency, and we have joining us today Dr. Scott Conard, who is Chief Medical Officer for Compass Care Engineering. Hey, Scott, good to talk to you again. Welcome.
Thank you so much. I'm honored to be here.
Yeah, good to have you back. And for our audience, Scott was with us at IHC Forum West in December and participated as a speaker in our transparency share session. So it's good to have you on with us today. Scott, give our audience kind of a background and overview of Compass, and then we'll get into some of the key talking points around transparency.
So Compass is a technology-enabled transparency, and when I say transparency, I mean three different transparencies: price, quality, and benefits. Mm-hmm. Concierge engagement, meaning that we have a human being that helps guide the person through the healthcare system, and population health management, meaning that we help corporations really focus on what's going to make the biggest difference for their corporation company. We've been around since 2007. We work with over 1,600 companies, many of them large names that people would recognize, and we're just honored that we have 1.5 million people who wake up every day with a Compass card that they can call their Health Pro, which is the concierge that we have for them, and be able to navigate the healthcare system effectively.
So concierge, Scott's one of your key differentiators. Is that correct? Scott, you there with us? We lost him.
Uh-oh. I think we lost him.
Yeah, hello?
Yes,
hey,
you there?
Scott, we got you back. Scott?
Can you hear us? We heard you, Scott. Must be going through a cell. I don't know if he's traveling. This whole area of transparency that he's trying to touch on is so critical. I'm glad there are companies out there like him that are trying to connect the people and give them choices and options. This whole concierge service concept is feeding its way through the entire healthcare system. And Scott, I don't know if you can hear us. If I hear some noise in the background there, maybe you're still there. But it is a terrific idea of connecting people on price, having price transparency, quality transparency, and getting to know their benefits more. You really can't have consumerism unless you've got information, and that's really what transparency is all about. And
to our eyes, we apologize. We're trying to get Scott back.
Yeah, I'm here.
I
got you back all of a sudden. I lost you, and now you've appeared.
Okay, good.
Hey, Scott, welcome back. Sorry about that, technology.
Yeah.
Scott, talk to, what I was alluding to, and Ron was kind of talking about it. The concierge component is one of Compass's differentiators. Is that correct?
That's right. When we first started off, we thought we were going to be a web-enabled solution for people. And that was back in 2005, 6, and 7. And so we created we got all the information, we reverse engineered it, and we started talking to our customers, to the people who were going to be using it. And because of the complexity of healthcare, just having information available on the Internet didn't feel like it was going to work with us. In fact, in our first betas, it was not successful from an engagement standpoint because people get intimidated with the complexity of care. So we decided that the best way to manage that was with a human being who can actually help the person navigate. I mean, a quick, simple example. Let's suppose you go to your doctor. They say you need an MRI of your shoulder. You walk out and you say, well, I need to figure out where the smartest place is to get an MRI. And you go to a website. First question that comes up is it with contrast or without contrast? And you as a consumer is going, I don't have contrast with what?
What does that mean?
Yeah.
Yeah, and so you're just stuck right there, and you never use it. That's why most websites and things that, from our experience, they're kind of a 3% is a good participation, because to know the correct knowledge and get all the way through it, you've got to do that. With the Compass model, you pick up the phone, you call Catherine and say, hey, Catherine, my doc said I need an MRI. Who is the doctor? Tell me what's going on. Do you know if it's with or without contrast? I don't. I will call the doctor's office, and we'll get it all set up. Within 24 hours, the person's empowered with, here's the MRI centers, here's what's going to cost you, here's where you can go. Would you like me to make the appointment for you? And I'll go ahead and send your health care information over to them. Yes, I'm off next Wednesday. And then they make the appointment, and the person is guided and supported as they go through the complexity of the healthcare system.
Well, I love the high touch, versus just the high tech. That especially in areas that are so complex and where people are just beginning to understand. you really do need that kind of a high touch that you're talking about, the concierge service approach. It sounds expensive to be able to do that, though. Tell us about the business model. How do you get people engaged? Are you selling through employers? Is it large employers? What's your target market? How do you make all this work?
It's for anybody who wants to use the healthcare system effectively. We do sell to corporations usually, but we have corporations as small as 4 people, and then we have large Fortune 500 corporations. It's a very easy model. It's $5 per employee per month. So, you can go to the bank on that. So it's very straightforward, and as you said, people love it. So we know that when people, and there's no charge per call. In fact, we not only take care of the employee, we take care of the employee's spouse, their children, their parents, their brothers and sisters. It's a nuclear family. Everybody who's in that family has access to the service for the same $5 per employee per month. So, and we know that when people call the service one time in a year, they will call on average 3 times that year. We also know that the 24.9% of all employees and all the companies that we work with call us every year. So 24.9% engagement. That's not just calling to say hi. That's calling with a problem that we give a solution for and work with that individual. So we didn't have a salesperson in the company until 2013. We hired our first salesperson, and we're growing 80% per year because once one company has hired us, they refer us to the second, third, and fourth company, and it's been really growing like wildfire.
Great.
What's some of the challenges, Scott, that your team deals with in getting the employees engaged? Because, to your point, if they call once, they're going to call 3 times. So how do you get them engaged that first time?
Yeah, it's a great question, and it's a lot of fun. It depends on the culture of the company. We really love to work with the company and find out, what motivates, inspires people in your company, and what have you done in the past that's successful. So, we start with the company and their view of it. But to be honest with you, we always end up in 4 or 5 of the same places, and that is that we will do a great job of communicating the service and what it is in the first place. It can be during open enrollment, but we actually like to be off cycle so people have more time. Then we do monthly communications with people with success stories, and often it's success stories of people who are actually in their own company. So there's nothing more powerful than that. We also have a Compass Champions program where we will take people that have had great success that send us, we get over 400 emails a month thanking us for the service. And we'll take those people and ask them if they'd be willing to share that with their other people. We put them through a 1-hour training to help them be able to share effectively. And then lastly, we try to encourage companies, pay your employees $10 to make that first call for us. Because believe it or not, for a $10 gift card, we get amazing engagement. In fact, most companies, once they do that, we're up in the 40% range. And people will call for $10 to have a healthcare problem solved, and it could be just to ask about their benefits or to have an EOB review, or it could be to ask for who's the best doctor or where do I get the best imaging done. All those kind of transparency issues, we will address them, and we have tremendous success. And lastly, if someone calls in and they get a price transparency solution that saves over $500 for the employee and the company, some companies are willing to pay that employee $50. And when we do that, again, we see tremendous engagement. We had 2 companies last year. One had 76% engagement. One had 93% engagement.
Wow.
I mean, and the amount of money that they saved was, the average savings when companies use our service is $8 for every $1 they pay us.
Oh, fantastic.
When those companies have that kind of engagement, they have $12 for every $1 they pay us.
Well, you cracked the holy grail. Everybody's trying to get engagement, so those kinds of percentage engagements are pretty impressive. Tell our audience, when somebody calls in, how do you assure the quality of the information and the data that you're providing to them? Where do you get that? How do you keep that up to date so that this service is refreshed constantly with new information and accurate information for that patient that's calling in?
Well, Compass has, we believe, the most accurate projections in the marketplace, and here's why. We have a huge database. In fact, I think we've got 14 million Americans' data in our systems. We buy that data, and we also, where it's appropriate and where insurance companies will allow us, today more and more insurance companies are comfortable with this, so we have to be very thoughtful and respect their wishes. Where they'll allow us, we actually put that data into the database, and every month we get data feeds from many of the 1,600 companies that we care for, so that we have the honor of serving. So our database expands monthly, and as we get more clients, it's getting larger and larger also. So we go through, we take that data, we reverse engineer fee schedules, and then when somebody comes in and says, hey, I need that MRI, we will actually have the number. So let's suppose that you're on Blue Cross Blue Shield of Texas, and we look in our system, and we think that it's going to be $850 for that MRI scan at this facility. We'll actually call the facility and say, hey, we're going to be looking at getting an MRI from your place. It's at the shoulder. It's without contrast. Could you tell us exactly what that will cost? And they tell us the cost, and we confirm our finding where necessary. So sometimes we just called that place a week ago, so we don't need to do that. But wherever there's any question, we call up and confirm that it's correct. So when we send the information over to the employee, they have a very good understanding of what it's going to cost them and how much of that's going to come out of their portion and how much the company's going to pay.
So if as people get used to it, and they make that first call, the second call, the third call, and they become educated, is there an app, a mobile app, or some other source they can go to get some of the information once they no longer need that hand-holding?
That's a great question, because what we find is people want to work on, usually on the internet, on the web, and email is the way they like to work. So the first time they like to talk to the person, the second time, third time, they're just going back and forth on email usually. We do have a web-enabled portal that they can go to. We also have the ability to have that on their telephone, so they can go back and forth and go to it's not really what it is. You go there, you say anything MRI scan, you answer a couple key questions, you put in your zip code and so forth, and it comes up with the 3 places that would be closest to you that would do that. And if any time you get stuck, you can call into your health pro immediately to help move past that or send her a quick note or him a quick note.
Hey, Scott, we've got about 30 seconds to go. Time flies when we're having fun here, and we really appreciate you being on here. Leave our audience with a couple takeaways, if you would, please.
Healthcare consumerism is part of the cure of the American healthcare system. It's vital to empower employees with tools. It's unfair, in my opinion, to give people all the responsibility and not give them the ability to do that. So we've got to break down the barriers of this complex system, and a human being is necessary to do that. So for prevention, proactive management, key to reducing costs, 30% of the money you're spending, you're wasting on healthcare if you're not getting the transparency and have a tool to get people to engage.
All right, Scott, listen, I really appreciate you joining us. Have a great weekend over there in Dallas, and we'll talk to you again soon.
It's an honor. Thank you. Bye-bye.
Thanks, Scott. And to our audience, stay tuned for the final segment of Healthcare Consumerism Radio.